Uh, Don, Don Herter from AIG. Can you discuss the landscape of opioid use in workers' compensation and the steps that AIG, as one of the largest workers' comp insurers, is taking to prevent addiction, as well as how opioid use affects the working population?
Yes. Thank you. And thank you for the invitation. I'm going to challenge you, as Senator Markey challenged us, that these were our employees that we were looking at. How many here in the room are responsible, either directly or indirectly, for employees? Almost everybody, either reporting to you or ultimately responsible. And what I'm going to address is what AIG did to be able to address its workers' compensation business. Although workers' compensation makes up approximately 3% of the overall medical, the WCRI out here in Cambridge, Massachusetts reported that 55% of all claimants, 55% of all claimants have opioid use. So we started looking into this problem in 2012. We took approximately 16,000 cases, and much like Blue Cross Blue Shield, we identified 18,000 cases that had the potential to be outside of guidelines. We followed the work that was being done by Dr. Gary Franklin in Washington State, and he identified really three different guidelines that we should follow. One was the opioid use over 90 days, long-term opioid use. Two was the morphine equivalent over 120 morphine equivalents daily. And three, was there an early dispense of a long-acting opioid? We targeted these cases with use of our pharmacy benefit management company, which partnered with CVS and others, to be able to make sure when a prescription came in that hit one of these alerts that we were notified. We hired 75 medical directors, many of them here from Massachusetts. We hired an additional 20 nurses to be able to address these issues with the treating doctor if they were outside of appropriate protocols. First, it wasn't just the pharma that we were addressing. It was the issue of what was happening to your employees. We saw in a Utah study that more than 7 days of receiving more than opioid doubled the odds of disability. You had 6 times risk of disability on claimants with strong opioids, and you had 14 times the risk of disability for more than 19 days of opioids. In our recent research, looking at the Journal of Occupational and Environmental Medicine, says if you combine it with benzodiazepines, there's an additional 14 times risk of disability that injured worker is going to be extended in their time off work 14 times. That's your employees, or the 1,500 AIG employees in New England that we had an obligation to protect. By using those 3 triggers, early dispense of a long-acting opioid, opioid use over 90 days, and opioids over 120 morphine equivalent, we were able to impact over 12,000 claims since 2013. Those claims were either blocked or weaned at point of intervention. We had a 71% impact. We had an 11% relapse rate. We had over 31,000 intervention and actions since 2013, and roughly over 6 million pills have either been stopped or taken off the market or weaned out of the system due to the intervention. The impact on cost, just on disability days cost, where workers were able to go back to work, was over $44 million. and lost work days that we were able to put workers back to safe and productive employment. And when tied into drug testing, we saw a reduction of 31.8 in overall days of OxyContin and opioid supply, and we saw a 25% reduction in spend. We send out the drug testing kits, the provider uses it, sends it back, whether they use their own drug test or someone else, drug testing is key within guidelines of opioid management. Thank you.
Thanks very much, Don. Attorney Chris Walsh from Harvard Pilgrim Healthcare has a distinguished background as a former prosecutor, now works in the private sector combating fraud, waste, and abuse in healthcare. Chris, can you tell us, we've heard what health plans are doing from a clinical perspective. How about what Harvard Pilgrim Healthcare and other plans are doing to address the opioid epidemic from a fraud, waste, and abuse perspective?
Thanks, Jim. And thank you for this opportunity to talk about what SIUs are doing and how we can be helpful in combating this epidemic. Special investigations units primarily are responsible for identifying fraudulent activity, so billing practices that may hurt a health insurer. But in our efforts and what we're doing, we're looking at mass volumes of claims data on a daily basis. So most health insurers, if not all health insurers, now have some type of special investigation unit that's looking at fraud, waste, and abuse. Most of those units are highly professional. At Harvard Pilgrim, our unit is made up of registered nurses, clinical coders, certified clinical coders. We have experienced data analysts, and we have a pharmacy auditing specialist that works with us. So we have the ability to be on the front line of seeing what's happening on a daily basis with the claims data. We're looking at different types of things we're seeing in the claims data to identify outliers. We're looking at whether or not a member's treatment history may be consistent with current treatment and current prescribing practices. We're looking for things that may identify potential concerns, such as members, what we call doctor shopping. So if we see a member that over a short period of time is seeing several different physicians, obtaining several different prescriptions, sometimes overlapping prescriptions for Schedule II narcotics, we're going to want to look at that a little bit further. If we see a prescriber that seems to have or seems to be prescribing at a very high volume, we're going to want to look at that prescriber a little bit further. If we see, for example, members who are traveling long distances, so we've had situations where we've seen our members who live in the Springfield area going down to the Cape to get a prescription and get that prescription filled. Well, we're going to want to look at that a little bit further to see why is that happening. And when we identify potential problems, and I think this is consistent across the health insurers, when we identify potential problems, so if we have a concern that a member may have a substance abuse problem or may have an addiction problem, we're going to reach out to our care management side, to our pharmacy side, to our PBM, and we're going to try to take some type of action as a health plan to work with that member and to work with that potential addiction problem so that we can ensure that member is getting the appropriate care and also that we're working with them to identify that substance abuse issue and hopefully eliminate that substance abuse issue. We also, in our efforts, are trying to reach out to prescribers. Most, if not all, prescribers are prescribing medications they believe are medically necessary, but they may not be aware of the full extent of the circumstances. So if a member crosses state lines and is able to get a prescription, a physician may not be aware of that. So we try to educate physicians on what they should be looking for, what types of things they should be aware of, what types of things they should report to us so that we can follow up on. We also are working with, so we have strong partnerships with law enforcement. On the Medicare side, we're working with the DEA, we're working with OIG, the Office of the Inspector General federally, the FBI on the state side. For Medicaid, the Attorney General's office has a Medicaid fraud control unit. We communicate and meet with them and identify problems that we're seeing. Other health plans are at those meetings, so we're able to share information in a way that doesn't violate any of our privacy laws. And so those are some of the steps that we take, being on the front line and seeing what we're seeing out there as far as substance abuse and addiction, and trying to take steps to work to eliminate those problems.
Thanks very much, Chris. We're just about out of time for this segment, and Jim Brett is going to transition us to the public sector efforts in this area momentarily. I'd just like to acknowledge a couple people I see in the audience who are involved from other perspectives. Attorney Robert LeBlanc, who as a member of as a public defender with the Committee for Public Counsel Services, works to divert defendants into treatment programs. And Attorney Laura Pellegrini from the Mass Association of Health Plans, who's been working closely with the Gloucester Police Department and John Rosenthal on their program to divert people before they even come into the criminal justice system to treatment programs. All of this works together, and I think it demonstrates the transition from all the efforts you've just heard about up here to the public sector. Now, this is a very serious topic.